Started out so high, but we got so low, while the smiles were wide.
Tranquilizers and sedatives, of course, as to be used in the animal patient. And you gotta love old school for this moment. Dude, you got a dart in your neck. You're crazy, but I love you. This is the best movie ever, because it's silly and ridiculous. And sometimes we need silly and ridiculous movies to make our brains just relax. Okay, so we are going to talk about tranquilizers versus sedatives to start off with. Tranquilizers are calming, soothing effect. They have a calming and soothing effect on the body. Keep in mind the root of that word is tranquil. And when you're tranquil, you're feeling good, everything's okay. A sedative makes the animal sedate, but it doesn't work to calm or reduce anxiety. Now, both of these, when we're talking about tranquilizers and sedatives overall, they do not necessarily produce analgesia for the animal. Some of them do. I will let you know which ones do, but some of them do not. And that is extremely important if you are part of a surgery, if the animal is having surgery, or if they're undergoing a very, very painful event. The RVT should realize that a tranquilized animal in a relaxed state is still quite capable of feeling pain and responding quickly and viciously to manipulations that elicit pain. Only if the animal is sedated so deeply that it begins to approach narcosis, so that's that state of sleep from which an animal is not readily aroused, or anesthesia, of course, will the animal's response to pain be reduced. So essentially, on their own, typically they don't provide analgesia. So you have to remember that. Very, very, very important. All right, so let's start with Acepromazine. It's a phenothiazine tranquilizer. It has zero analgesic effect. Okay, so highlight that in your notes. It has zero analgesic effect. It's often used to calm animals who are being hospitalized. Sometimes it's used for transportation of animals, and it has the potential to decrease inhibition of seizures. So that means that animals that have already have a seizure disorder, they've had seizures in the past, we want to avoid using acepromazine as much as possible. It does cause hypotension, and that's not ideal. And it's metabolized by the liver and it's excreted by the kidneys. So it should be used in animals who do not have liver or kidney insufficiency. And we often give it intramuscular, subcutaneously, intravenously, and of course there are these yellow acepromazine tablets that can be given by mouth as well. Sometimes we use acepromazine because it has the potential to prevent vomiting during transport, because it has anti-dopamine receptor activity. And it also reduces stimulation of the CTZ, the chemoreceptor trigger zone, so it can be used in combination with cancer treatment drugs that cause vomiting. So acepromazine, it does give a really decent amount of sedation, and it also can be used for a little bit of prevention of nausea. It's an alpha-1 receptor blocker, which means it creates a drop in blood pressure. Avoid with animals who are undergoing shock, have blood loss, dehydration, and watch out for hypothermia. So essentially this drug works by blocking the alpha-1 receptors found on smooth muscle cells of peripheral blood vessels that cause vasoconstriction of the precapillary arterioles, i.e., by blocking these receptors, it results in a relaxation of the smooth muscle. If the animal is attempting to maintain arterial blood pressure by stimulating vasoconstriction, this alpha-1 receptor blocking activity, combined with acepromazine's direct relaxation of vascular smooth muscles and depression of some normal blood pressure regulatory mechanisms, this drug has the potential to produce a marked drop in blood pressure. For this reason, phenothiazines should be used with caution or not used at all with animals who have hypotension, so decreased blood pressure, as mentioned previously. Okay, so essentially it's a receptor blocking activity which results, instead of in those muscles constricting as they normally would, it causes muscles to relax in the vessels, in the blood vessels. And that's what causes the marked hypotension. So put a star beside acepromazine about hypotension as well. Acepromazine is also fun in that it can cause marked or profound sedation with really tiny amounts. But there are also these reports of it causing aggression and hyperactivity in cats and in some dogs. It's somewhat anecdotal, so there haven't been studies that identify this aggression and hyperactivity, but you never quite know how the animals will react to it. In other animals, there's tons of relaxation, and you'll see the nictitating membrane prolapse. So that's that third eyelid comes up. They get really, really, really sedate. But you got to watch out because let's say 1 in 150 animals will react with that hyperactivity and aggression. Personally, I have not seen an animal react in this way, and I've seen a heck of a lot of dogs and cats with acepromazine on board. Every dog and cat that I've seen, we give a tiny, tiny, tiny amount of acepromazine, and it's just enough to make them feel really, really sedate. Caution with use in stallions. We typically try to avoid this, especially in breeding stallions, because it can cause temporary or permanent penile prolapse, which of course means that the penis comes out of the sheath and it doesn't retract. So again, that's that essentially some of the muscles relaxing and not allowing it to come back into itself. So this can create, of course, long-term challenges with breeding. And if that's an expensive stallion and you're the RVT or the veterinarian that decided to give it a dose of ACE, and this happened, that's on you. So it's very challenging. We got to be careful of that. All right, so here's your chart. Acepromazine. The class is sedative/tranquilizer, and subclass, it's a phenothiazine tranquilizer. Trade names, the one that we get here a lot is Atrovent, and it is 10 mg per ml. Mode of action, it's an alpha-1 receptor blocker, and it's a dopamine receptor blocker, and it's overall an antagonist for many receptors, so it's a blocker, like I was saying. Positive effect, it can cause really profound sedation in small doses, and it can be used to prevent nausea and vomiting. Now, that being said, just noting, again, I've said that it's a small dose about 55 times so far. So because acepromazine is typically 10 mg per ml, cats get microdoses. So cats might get like 0.005 mils is their dose of the 10 mg per ml. That's really difficult to measure accurately in a tuberculin syringe. So oftentimes what we'll do is dilute the acepromazine with like 9.8 mils and create a 1 mg per ml solution to then draw from. Side effects, hypotension. So I really want you to star hypotension. And of course, associated concerns otherwise with hypotension, including hypothermia. Because with hypotension, you can get hypothermia quite easily because the vessels are relaxed. They're allowing a lot of blood to just be sort of, I always picture it as like allowing the blood to be loose and just exploring, which of course means it can be exposed to the colder temperatures more readily. The seizure threshold can decrease, and it can add onto other effects of sedatives and barbiturates. So it can really enhance those effects to a point where we might not be able to always predict how that will happen. Unpredictable hyperactivity or aggression, and of course the potential for penile prolapse in stallions. Now, your textbook also noted the nictitating membrane as a negative side effect. So that's that third eyelid that starts to show. I don't know if I would technically call that a negative side effect. It's more just something that happens. You just have to make sure with essentially any drug that's starting to immobilize a patient, we always want to make sure that we've put lubrication in their eyes so that they're not getting dried out and irritated and potentially ulcerated. Acepromazine can be given intramuscularly, intravenously, sub-Q, or orally, as mentioned previously, and it is not a controlled drug because it does not have the potential for addiction. So looking at the overall with acepromazine, it's really important to note that we give this in young, healthy dogs. So dogs and cats, I should say. Sorry, that should say dogs and cats. So animals that are overall pretty young, healthy, they don't have issues around hypotension, they don't have issues with their liver and kidneys, that is who we would give this drug to. Benzodiazepine tranquilizers is the next class of drugs we'll talk about. Anything that ends in a PAM, so EPAM suffix, such as diazepam, midazolam, sorry, I can't speak because I have a cold, midazolam, and clonazepam, those are all benzodiazepine tranquilizers. Calming, muscle relaxant effects are part of being a benzodiazepine tranquilizer. And they enhance the activity of the GABA receptors. Now, there's a really great video that kind of helps put some visuals to this concept. So I will put the link to this video in our playlist for pharmacology so you guys can review it. So they combine with GABA to inhibit neurotransmission. GABA is GABA aminobutyric acid, quite a mouthful, an inhibitory neurotransmitter in the central nervous system. Benzodiazepine molecules will attach to the GABA receptor and cause enhanced binding of that GABA molecule with its receptor, thus enhancing its effect. By increasing GABA's inhibitory activity, the brain becomes less active and the animal appears to become less agitated and more relaxed. This same CNS inhibitory effect makes them effective anticonvulsant medications as well. So it creates beautiful muscle relaxant, it creates beautiful calming effect on the animal, and we can use it in seizuring animals to a point as well. Benzodiazepines are another one that have zero analgesic effect. So again, I want you to star that in your notes. Really important to know. But we often use them in combination with opioids that do have, of course, beautiful analgesic effect. So midazolam hydro is really, really common to give an animal a high level of sedation and sort of anti-anxiety, and then, of course, a lot of pain medication, pain aspect as well. Inhibition of seizures is a property of benzodiazepines, and they are the primary line of defense in seizure activity. So diazepam, of course, if we have an animal that is actively seizing, we immediately grab our dose of diazepam to give that animal, ideally IV, if they have an IV catheter placed or if we can wrangle them and get a vein. Otherwise, you can actually take off the needle, so get rid of the needle, use the syringe, and give that diazepam intrarectally. And you can also give it intranasally as well. So with that, of course, it's going to cause a lot of muscle relaxation, and it just prevents those neurons from firing within the brain. There are no obvious effects on cardiac or respiratory processes, which is really great. We often will use, especially midazolam, in older animals. And if we need to, we can reverse it with flumazenil. So I'll talk about that in a minute. So just going back, of course, I mentioned hydromidazolam. We also tend to use benzodiazepines as part of an induction agent for anesthetic. So we'll typically mix it with ketamine, and most often, you can do ketamine midazolam as well, but most often we'll do ketamine and Valium in a 50-50% solution, and then give that intravenously for anesthetic to induce the animal under anesthetic. And that is a really good, high value and fairly safe injectable anesthetic for most animals. So going back to the seizures, so the benzodiazepines enhance GABA effect. That inhibits the seizure foci, so the areas that are the origin for seizure activity in the brain. And that's how they prevent the potential spread of seizure waves. So the potential spread of seizure waves of depolarization throughout the brain. So essentially, when the GABA effect is increased through the application or administration of benzodiazepine, this inhibits that depolarization wave of seizure activity through the brain. So that's what I was kind of saying by just stopping those crazy firing neurons from going off non-stop, because seizures are really, really scary in the brain. Many anesthesiologists will use benzos, so benzodiazepines, in their pre-anesthetic mixes. And another advantage, of course, I was mentioning a second ago, is reversal with flumazenol. But reversal with this drug technically can cause seizures because, again, you're sort of taking away that effect of inhibiting those seizure type that depolarization of neurons in the brain. So it's just something to keep in mind. In high doses, technically it can cause a seizure in a healthy animal, but otherwise we have to keep in mind that if the animal has potential for seizures and we give this medication to reverse the effects of the benzodiazepine, then we are at risk of starting a seizure process in the brain. Additional uses, yum, 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 yum. So we often will use benzodiazepines as, okay, maybe I'll take that back. I wouldn't say often, but benzodiazepines can be used as appetite stimulants in cats, often when given IV. So because of their stimulatory effects on the appetite center in the brain, diazepam and midazolam are the ones that are commonly used to increase appetite in those anorectic cats. However, because hepatic failure has been reported in cats given repeated oral doses of diazepam, this practice is becoming less common. Times that I've seen it used are cats that are really quite desperate to eat. So the only problem is, of course, if hepatic failure has been identified in giving midazolam or diazepam to cats that aren't eating, so long-term giving it to cats that aren't eating, you have to keep in mind what disease process kicks in as well when cats don't eat. So if a fat cat or a cat in general doesn't eat for a period of time, they're at risk of getting fatty liver disease, which is hepatic lipidosis, which is essentially liver failure or liver function suppression, but it's a big deal. So they're already at risk when they're not eating of getting this hepatic disease. And then if we are routinely administering them Valium, so diazepam, or midazolam to get them to eat, then we have definitely increased their chances of getting hepatic disease. So I've seen it used in really severe cases, typically with shelter cats that are on IV fluids, and we'll give them IV midazolam or diazepam. But it's just something to note that this is a stopgap measure. This is not long-term use to get them eating. Some side notes about benzodiazepines: they are light sensitive, so we have to keep them in a cupboard, and then they're in a dark vial. And have caution with plastic storage. So if they are transported into like a syringe to send home with clients, sometimes we'll send home a couple doses of diazepam for clients who have seizuring dogs. In case they start to seize again, then the client can give it intrarectally, rectally. But that diazepam can't sit for very long. I don't know exactly how long it can sit for, but over time with plastic, it can actually get absorbed into the plastic, and it can start to deteriorate that plastic. Really important. It is metabolized by the liver and it's excreted by the kidneys. So, blah, 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 blah. Diazepam, midazolam, lorazepam, clonazepam are all various types of benzodiazepines. So benzodiazepine is the class, and that is a tranquilizer. I spelt tranquilizer wrong. There should be another little I there. So trade names: diazepam, we've got Valium is its trade name. And the way we give it is deep IM, so really deep into the muscle. Intravenously is most ideal, and you can give it rectally and intranasally. So that is the most commonly used benzodiazepine, and especially it's the most commonly used for seizing animals. And then we have Lorazepam, which is Ativan in people, so the trade name is Ativan. For humans, it's used as definitely an anxiolytic, so an anti-anxiety medication, and sort of like people would take it if they're feeling very anxious or if they're having a panic attack, and typically it's quick release tablets. In animals, we do have regular tablets that we can give for lorazepam, and it's often used as well to reduce anxiety in pets. Their dose is much higher than that of people, so just do keep that in mind. Just keep it in mind, that's all. Midazolam, we can have the trade name of Versed. And we give this one as well, typically deep IM or IV. And this, I would say, is the second most common benzodiazepine. Typically, we're mixing it with like hydro or ketamine for either inductive anesthetic or as analgesic and sedative type properties. And then there's clonazepam, which similar properties to lorazepam, and it's Clonopin. I don't know that we have Clonopin here, but we definitely do have clonazepam, and that's administered by oral route. Mode of action is an attachment to GABA receptors, and then, of course, creating that enhanced effect when it attaches to GABA. Positive effects, we've got muscle relaxation, seizure inhibition. It's safe for cardiac and respiratory patients. Technically, it is reversible, although we know that the reversal may in fact cause seizures, and it can be used as an appetite stimulant. Caution or side effects, it combines well with ketamine for sitting in long-term use. So as a premix to sit in a vial, a multi-use vial, ketamine is the one that it's stable with. For short-term use, we can mix it with opioids, give it, not a problem. But for long-term use in a multi-use vial, ketamine is the one that we can mix it with without it causing an issue. And if we are giving it into an IV line, and if that IV line, let's say the IV line has something like potassium in the bag. So it's a bag of fluids attached to the animal and it has additives in the fluids. We would need to make sure to flush the line first with sodium chloride, then administer our diazepam, and then flush the line again before we release those other drugs into the line. Because benzodiazepines overall, they do not mix well with water and they do not mix well with other drugs. So what that means is they start to create these little solutes in line, these little tiny particles that of course could enter into the bloodstream. So we do have to be very cautious when we give this, just for that reason, to make sure that we're not creating any little precipitates is the word I was looking for in the line. Just going back to clonazepam, sorry, it just popped into my head. Clonazepam is most commonly used for seizure inhibition or control of animals who have typical seizures. So it's often used either in combination with or alongside or after phenobarbital, which we'll come back to if you haven't already learned about it. Now, benzodiazepines are controlled substances. Keep that in mind. All right, and then we'll talk about one of my favorites, alpha-2 agonists. These are sedatives, and they do have analgesic properties as well. Within this class, we're talking about Xylazine, Dexmetetomidine, and Detomidine. Now, there's also Medetomidine, so just take away the Dex, and it's just Medetomidine. Most of these are on label for dogs and cats, and then we have some that are on label for horses, and then they have use in cattle as well. So essentially, these are alpha-2 agonists, so they attach to the alpha-2 receptors, and they decrease norepinephrine release within the CNS and PNS. Okay, so CNS, of course, is central nervous system, PNS is peripheral nervous system, and I have to admit, it's just funny to say PNS. Why not? Penis. So the alpha-2 designation refers to the mechanism by which these drugs act. When these drugs attach to and stimulate alpha-2 receptors located on the terminal of the norepinephrine secreting neurons, they decrease norepinephrine release from the neuron both within the central nervous system, CNS, and the peripheral nervous system, the PNS. Because norepinephrine is part of the sympathetic nervous system and plays a role in maintaining general alertness, general inhibition of norepinephrine release by Xylazine, Detomidine, or Medetomidine, or of course Dexmetetomidine, results in sedation, and it's quite significant sedation. The degree of sedation with alpha-2 agonists is said to be more predictable than that of benzodiazepine or phenothiazine tranquilizers. Okay, so just keeping that in mind. So these drugs attach to and stimulate the alpha-2 receptors, and that decreases norepinephrine release from the neuron. Okay, and norepinephrine is the one that I always think of as heightened alertness. Like norepinephrine is like go, 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 regular alertness, awake, aware of the situation, etc. So they latch on to alpha 2 receptors and they decrease the norepinephrine release. And that, of course, is what creates the sedation. So they have profound sedation. Typically, it's more predictable. They have a little degree of muscle relaxant and they decrease perception of pain. However, important to note that the sedation lasts longer than the analgesic. So if the procedure is more than 20 minutes, the painful procedure, be aware that the dog or cat can jump up and bite you in the face. Okay? Now, this picture, of course, is probably not a Chihuahua who had an alpha 2 agonist. This is probably just a Chihuahua saying hello, as Chihuahuas do. So even if the animal looks sedate and comfortable, a sedated patient is not fully incapacitated with alpha 2 agonists, and they can react. You cannot forget that. We have to remember that. So if we're giving a straight up alpha 2 agonist and we're doing porcupine quills on the dog and we're working in that dog's mouth and our face is really close to that dog's face, you need to be careful and you need to take caution, because if you disturb that dog, if you make them painful, and that's a longer procedure than 20 minutes, then they can whip up and bite you. So this is the one, it's really messed up, but they look extremely sedate. They look totally out of it, and then they can wake up and bite you or nip at you or react. What they're doing is reacting to the pain without a lot of awareness. Okay, really important. So again, alpha 2 agonists in stressed or fractious animals, it's best to mix it with an opioid when we're giving it, because we know that alpha 2 agonists, they decrease the amount of norepinephrine release. So they're decreasing the amount. But animals that are really, really, really stressed or really, really, really aggressive, they already have crazy amounts of norepinephrine circulating in their body. So alpha 2 agonists do not have a chance of combating that amount of norepinephrine. So often what we see is we'll give them one dose of dexdomitor, which is dexmetetomidine, and nothing happens. Half an hour later, we'll give them another dose. And in the end, we have to give them a totally different drug because that's just not working. What ends up happening, because it's reliant on the amount of norepinephrine floating around in the brain and the body, when the animal gets home and is with his owner and is nice and relaxed, there you go. Your alpha 2 agonist kicks in, and then the owner all of a sudden has a really sedate dog at home, which can be very scary and very stressful. So this happens. I've seen it happen. Just be aware of that. If it's a really angry, really upset, really stressed out animal, always, the vets will often be encouraged to mix it with an opioid to help increase that level of sedation and not just rely on the decrease of norepinephrine. Another one, what was I going to say? I was going to talk about my dog. So my dog, well, the one that I introduced you to, the big Great Pyrenees, who had everything wrong with her in the world. I'm pretty sure I did say that I would talk about her in every lecture because something in every topic that I teach, she had an example of. So she's a perfect example of alpha 2 agonists. She had crazy anxiety. So she was also on Lorazepam. Let's bring it back to benzodiazepines. But she was on, we gave her an alpha 2 agonist. I think it was to do x-rays, perhaps. And that dog, it had the opposite effect. And I've heard of this anecdotally as well, where some animals actually get more hyperactivity with alpha 2 agonists. It's rare, but I have heard of it, and my dog was definitely one. So she became increasingly aware and increasingly more anxious. And I remember when I took her home that night, all she did was stare at me beside the bed and pant and whine. And you know when dogs do that whine on exhale, and it's every single exhale, and it's the most irritating and painful thing to listen to? I love that dog so much. So that's something to consider too. Not every animal will it knock out entirely and give really good sedative effect. There's always these weird ones where they just don't read the textbook. So alpha 2 agonists do have a ceiling effect. So higher doses of alpha-2s won't increase the level of sedation. Once they've reached their peak, it only makes it last longer. So keep that in mind as well. So once you've given sort of like the high dose of your alpha-2 agonist, it's not going to, anything more than that, it's not going to make them more tired or sedate. It's just going to make it last longer. Vomiting is common in cats, and it's vomiting in general. It's common immediately following administration. So it directly stimulates alpha receptors in that chemoreceptor trigger zone. Cats, it's the number one emetic drug to give. So a lot of people will give cats dexmetomidine, so dexmetetomidine, or just medetomidine to elicit emesis. Xylazine and Detomidine are typically used in horses, and they're best for like colic pain that they'll often use them for. So, of course, to provide a bit of sedation, and we do use it in horse anesthesia too as the pre-medication. So to provide sedation before we give anesthesia, but it has really good effects. So alpha-2s have really good effect on equine gut pain, so visceral pain. It's really good. It's less effective for skin and tissue pain. Something to keep in mind. And then Xylazine. Xylazine is one that we often use for large animal, but technically we can use for small animals too, so in dogs and cats, but it's a hefty drug, so we tend not to, and the doses are they're pretty tiny doses for a dog and cat. So in barrel-chested dogs and in cows, Xylazine can increase gas distension, which of course can cause pain. And in barrel-chested dogs, we'd have to watch out for gastric dilatation volvulus, where the stomach flips. And the downside continues. So these alpha-2s are riskier for older animals. After the initial injection, they get vasoconstriction. So essentially, the blood pressure initially increases in response to the alpha-1 receptor stimulation and peripheral vasoconstriction of precapillary arterioles. This response illustrates that these drugs are not specific for alpha-2 receptors, although medetomidine is more selective for alpha-2 receptors than xylazine or detomidine. Generally, medetomidine has fewer cardiovascular side effects than xylazine or detomidine. And it's also important to point out that dexmetetomidine has even less cardiac effects and is even more sensitive to the alpha-2 receptor. So that initial vasoconstriction, which means we tend to get pale mucous membranes, and not just pale, we tend to get like gray mucous membranes with these alpha-2. So it's really important, alpha-2 agonists, that we acknowledge that if we've given an alpha-2 agonist, that it's normal to see these pale to gray mucous membranes, at least for the initial period after injection, and normally it lasts until the reversal is given. Bradycardia is profound with these guys. So the body recognizes that vasoconstriction is happening, and it accommodates by slowing the heart rate down. And the initial vasoconstriction is countered by an overall decrease in sympathetic stimulation, and blood pressure eventually does return to normal. But during the bulk of the time where these alpha-2 agonists are on board, we'll get vasoconstriction, so we get pale, a little bit gray mucous membranes, when we're looking at their gums and whatnot. And then the bradycardia kicks in, and it's quite pronounced. So what they say is it's common to get half the animal's regular heart rate. The lowest I've been comfortable with is 30 beats per minute for a large dog. And at that point, the second it dips below 30, we're starting to give a reversal for the medication. Okay, so profound bradycardia is common. It's something that you do need to be comfortable with. Their blood pressure during this time is great. So typically really quite great blood pressure. Cattle need 10% more of the dosage of xylazine compared to horses, and that's actually a good thing. I have it on the negative side effect chart, but it's actually a good thing. And vomiting occurs especially right after the injection, and mostly it occurs in cats. And we actually use it as the #1 emesis induction agent in cats. So it's really good for induction of emesis, straightforward in cats. So the really great news, happiness and sunshine, is that this medication is reversible. So alpha-2 agonists are reversible. Yohimbine, etipamazole, and tolazoline are the reversal agents for this. So that's really, really important, especially when we're talking about a bradycardia and heart rate of 25 in a big dog. That's when we're going to start to get the reversal on board. But you have to remember that it also reverses the analgesic effect. So if you are, again, if the animal is undergoing a painful procedure, porcupine quills, or whatever it might be, and we reverse them because the systemic effects of the drug are having negative consequences, we have to remember to give an opioid or another type of analgesic so that they don't just wake up screaming and biting because they're in pain. Really important. And it's really easy, especially, so I think it's the same for all, but definitely the one we use in small animals is Dexmetetomidine. And we give the same amount of atipamazole as we gave Dexmetetomidine. I always get that mixed up. Okay, so if we gave 0.2 mils Dexmetetomidine, then we're going to give 0.2 mils of atipamazole, which is often called antecedent as the trade name. So looking at our alpha-2 agonists, Xylazine, Detomidine, Medetomidine, Dexmetetomidine, and Romifidine, we don't talk about Romifidine at all. Xylazine you will see used in large animal, definitely, as well as Detomidine, and Medetomidine and Dexmetetomidine we see used all the time in small animal. So they are alpha-2 agonists. It's a sedative and an analgesic. They are not controlled substances. Trade names for dexmedetomidine, we have Dexdomitor, and that's for small animal. Medetomidine is called Domitor. Xylazine, Rompin. Detomidine is Dormicidine. And Romifidine is Sedivet. So Romifidine, the only time I've seen Romifidine used is in equine standing anesthesia or borderline standing anesthesia where they're at the point where they're going to fall. Mode of action, alpha-2 agonist, it decreases norepinephrine secretion, and of course that norepinephrine keeps the animal awake, alert, go. When we decrease that, of course they're going to have more muscle laxity, they're going to be less aware, and become quite sedate. Positive effects, profound sedation, some muscle relaxation thanks to that norepinephrine, lack of norepinephrine secretion, analgesia, happy blood pressure, which is really great. They have great blood pressure typically throughout the sedation process. And really great, my favorite part is that it's reversible. So if we are not comfortable with the effects of this drug, we reverse it. It is the emetic choice for cats, and it's really great for visceral pain in horses. Side effects, of course, we have that initial vasoconstriction, which results in pale mucous membranes and poor circulation to the peripheral arteries, essentially. We have marked bradycardia. It's not safe for animals with cardiac or respiratory challenges because we're changing the way their heart functions during this period of time. Have caution on its own for fractious or stressed animals because of their high norepinephrine in the body. It could end up that the drug doesn't work, it's not able to reduce the amount of norepinephrine, and then they end up going home and getting really sedate once they're calm. It can cause uterine contractions in cows, Xylazine can, so you have to be very cautious if they're pregnant and we're using Xylazine. Excess gas production, which of course in large dogs could cause gastric dilatation volvulus, and either way it's quite painful in cows and dogs. And it does have a ceiling effect. So again, by giving more, you're not going to create a higher effect, you'll just make it last longer. One thing to note too, we have to have caution using anticholinergics, which I think we'll talk about more when we talk about cardiac medication. So anticholinergics essentially stimulate the heart to function more rapidly, more efficiently. And we'll give them in instances of bradycardia But it's not advised to give anticholinergics if you're experiencing profound bradycardia with alpha-2 agonists. So if the bradycardia gets really quite profound, the veterinarian's not comfortable with it, then instead of giving an anticholinergic to speed up that heart rate, we'll just start reversing the alpha-2 agonist.
Started out so high, but we got so low. While our smiles were wide, our hearts beat slow.